Picture this, it's September 30th, 1999, Tokaimura, Japan. Inside a nuclear fuel processing plant, 3 workers are doing a routine task, mixing uranium solution for a nuclear reactor. They've done this hundreds of times before. It's a normal workday. Everything seems fine. Then at 10:35 a.m., something goes catastrophically wrong. A blue flash fills the room, the telltale sign of a criticality accident, an uncontrolled nuclear chain reaction. Within seconds, the 3 workers are exposed to massive amounts of radiation. Alarms blare. The facility goes into emergency lockdown. One of those workers is Hisashi Ouchi, a 35-year-old technician. He's standing closest to the reaction. In an instant, less than a second, his body absorbs more radiation than anyone has ever survived. He doesn't know it yet, but his body has just received a death sentence. Every cell in his body is dying or already dead. His DNA is shredded beyond repair. But here's the horrifying part. Hisashi Ouchi doesn't die immediately. His heart keeps beating. His lungs keep breathing. And for the next 83 days, doctors will keep him alive using every medical technology available, even as his body literally disintegrates from the inside out, even as he begs them to let him die. This is the story of Hisashi Ouchi, the man who suffered the highest radiation exposure ever survived for any length of time, and who endured what may be the most painful death in modern medical history. It's a story about the limits of medicine, the ethics of keeping someone alive against their will, and what happens when the human body receives radiation levels that should kill instantly but don't. This is real, this is documented, and it's absolutely horrifying. Let me take you back to that morning in Tokaimura. The JCO nuclear fuel processing plant is a small facility that converts uranium into fuel for nuclear reactors. It's not a major installation, just a processing plant with a small staff. The work is routine but requires following strict safety protocols because they're handling radioactive material. On September 30th, Hisashi Ouchi and 2 co-workers, Masato Shinohara and Yutaka Yokokawa, are tasked with preparing a batch of uranium fuel. The process involves mixing uranium oxide with nitric acid to create a uranium solution. The proper procedure requires using automated equipment designed to prevent dangerous concentrations of uranium. But there's a problem. The automated equipment is slow. The company is behind schedule. Management wants the work done faster, so the workers have developed a shortcut. They manually mix larger batches of uranium in steel buckets instead of using the proper equipment. This is incredibly dangerous. The buckets aren't designed for this. There are no safeguards. If too much uranium accumulates in one place, it can reach critical mass, the point where uranium atoms start splitting uncontrollably, releasing massive amounts of radiation in a chain reaction. That morning, Ouchi and his co-workers are following this unsafe shortcut procedure. They're pouring uranium solution into a precipitation tank. They're supposed to add small amounts gradually. Instead, they add about 16 kilograms of uranium all at once, 7 times more than the safe limit. The moment that uranium reaches critical mass, the nuclear chain reaction begins. A blue flash, Cherenkov radiation fills the room. The workers don't understand what's happening at first. The flash lasts only seconds, then it's over. The alarms go off. The workers evacuate. At this point, Ouchi doesn't feel anything unusual, maybe a little nauseous, but he can walk. He's conscious. He's talking. He has no idea that his body has just absorbed 17 sieverts of radiation, the equivalent of being at ground zero of both atomic bombs dropped on Japan in World War II. For context, exposure above 5 sieverts is almost always fatal. Ouchi received more than 3 times that amount. His co-workers were also exposed but less severely. Shinohara received 10 sieverts. Yokokawa received 3 sieverts. Both of these doses are fatal but not immediately catastrophic like Ouchi's. Within hours, Ouchi is admitted to the University of Tokyo hospital. The doctors know this is bad, really bad, but they don't yet understand just how hopeless it is. They start treating him for radiation exposure, anti-nausea medication, IV fluids, monitoring his vital signs. Day 1, Ouchi is conscious and talking. He's nauseous and uncomfortable, but he seems okay considering what he's been through. The doctors are cautiously optimistic. Maybe he'll beat the odds. Maybe modern medicine can save him. They're wrong. Day 2, -3, Ouchi's condition starts deteriorating rapidly. His white blood cell count, which should be around 5,000 to 10,000, drops to near zero. His immune system is destroyed. His body can no longer fight infections. His skin starts showing signs of damage, redness, swelling, blistering. Day 5. The full extent of the damage becomes clear. Doctors run tests on Ouchi's chromosomes, the DNA structures inside cells. The results are horrifying. Ouchi's chromosomes are completely destroyed. They're not just damaged, They're shattered, scattered, gone. His DNA looks like it's been run through a shredder. This means Ouchi's body cannot produce new cells, at all. Every cell in the human body has a lifespan. Skin cells live about 2 weeks, blood cells about 4 months, intestinal lining cells just a few days. When cells die, they're replaced by new cells through division. But cell division requires intact DNA. Ouchi's DNA is destroyed. His body cannot make new cells to replace the ones that are dying. He is in the most literal sense, rotting from the inside out while still alive. Day 7 Nos 10. Ouchi's skin begins to fall off. Not just peeling, entire layers of skin detach from his body. The medical staff has to wrap him in special bandages, but the skin underneath continues to die. His body is covered in radiation burns that go deeper than any thermal burn could. The damage is at the cellular level, killing skin cells faster than they can regenerate. Ouchi is in excruciating pain. The doctors give him massive doses of morphine and other painkillers, but the pain is so intense that nothing fully helps. He starts crying, begging the medical staff, "I can't take it anymore, please let me die." But the doctors don't. They can't. Legally, ethically, professionally, they're committed to keeping him alive. His family wants them to try everything. The hospital's reputation is on the line. The Japanese nuclear industry is watching. Failure means admitting that modern medicine is powerless against extreme radiation. So they keep fighting. They try everything. Day 11, 20 Ouchi's gastrointestinal lining, the cells that line his stomach and intestines, completely dies. This is catastrophic. The GI lining is one of the most rapidly dividing cell populations in the body. Without it, Ouchi cannot digest food, cannot absorb nutrients, and his intestines start to rot inside him. He's put on total parenteral nutrition, IV feeding directly into his bloodstream. His lungs start failing. The radiation has damaged the cells lining his airways. Fluid accumulates. He develops acute respiratory distress. He's put on a ventilator. His heart is struggling. The radiation has damaged his cardiovascular system. His blood pressure becomes unstable. He requires constant medication to keep his heart pumping. But he's still alive. His brain is intact. The skull provided some shielding from radiation. He's conscious for much of this. He knows what's happening to him. He can feel everything. Day 21, 30. Ouchi's condition is now beyond anything in medical literature. He's being kept alive by machines, medications, and round-the-clock intensive care. But there's no healing. There's no recovery. There's only progressive deterioration. His skin is gone. Most of his body is exposed muscle and tissue, constantly weeping fluid. The medical staff changes his bandages multiple times per day, but there's no skin left to heal, just raw, dying tissue. His blood can't clot anymore. His bone marrow, which produces blood cells, is completely destroyed. Without new blood cells, he's constantly on the verge of bleeding to death internally. Doctors give him multiple blood transfusions per day, but it's like pouring water into a broken bucket. Ouchi continues begging to die. "I can't take it anymore," he tells the doctors and nurses. "Please stop, please let me go." But the medical team continues treatment. They believe, or want to believe, that they might save him. Day 35. Desperate to do something, anything, doctors attempt a radical treatment. They transplant peripheral blood stem cells from his sister, hoping to regenerate his destroyed bone marrow and give his body the ability to produce blood cells again. It doesn't work. The transplant fails. Ouchi's body is too damaged to accept it. The radiation damage is too extensive. There's nothing left to rebuild from. Day 40, use 50. Ouchi's organs are failing one by one. His kidneys stop functioning. He's put on dialysis. His liver is deteriorating. His body is accumulating toxins that should be filtered out but can't be. His face is unrecognizable. The skin on his face has died and sloughed off. His eyes are swollen shut. His breathing is labored even with the ventilator. Every breath is agony. Every heartbeat is prolonged suffering. Medical staff who work with him develop psychological trauma. Nurses cry after their shifts. Doctors question whether what they're doing is medicine or torture. Some staff request to be transferred away from Ouchi's care because they can't handle seeing him suffer. Day 60, night at 70. Ouchi has multiple cardiac arrests. Each time doctors resuscitate him, his heart stops. They restart it. It stops again. They restart it again. He's being kept alive through sheer force of medical technology. His body weight has dropped dramatically. He's lost most of his body mass, skin, muscle, tissue, all dead and gone. He looks like something from a nightmare. Medical photography documents his condition, but the images are too disturbing to ever be publicly released. Ouchi is rarely conscious now. The pain is so severe and constant that he's kept heavily sedated. When he does wake, he screams. Morphine barely touches the pain. His entire body is one giant exposed nerve. His family is torn apart watching this. They want the doctors to save him. They also want his suffering to end. They don't know what to do. The decision is taken out of their hands. The medical team continues treatment. Day 81, 82. Ouchi has a massive heart attack. Doctors resuscitate him again. His organs are shutting down completely now. His body is in multi-organ failure. There's no recovering from this. Everyone knows it, but they keep going. December 21st, 1999, day 83, at 11:21 p.m., Hisashi Ouchi's heart stops for the final time. Doctors attempt resuscitation. It doesn't work. They try again. Nothing. After 83 days of being kept alive through machines, medication and medical intervention, Ouchi's body finally gives up completely. He's pronounced dead at 11:21 p.m. The official cause of death, multiple organ failure due to acute radiation syndrome. Hisashi Ouchi endured 83 days of unimaginable suffering before finally being allowed to die. 83 days of his body slowly disintegrating. 83 days of pain so severe it's beyond description. 83 days of begging doctors to let him die while they kept him alive. His co-worker Masato Shinohara survived 211 days before dying from similar radiation-induced organ failure. Yutaka Yokokawa survived but suffered severe health complications for the rest of his life. The aftermath of Ouchi's death was explosive. The medical ethics community in Japan and worldwide questioned whether keeping him alive for 83 days was humane or ethical. Did doctors have the right to keep someone alive when there was zero chance of recovery and the patient was in constant agony? The JCO company and several executives were prosecuted for negligence. They'd knowingly violated safety procedures to save time and money. Their shortcuts killed Ouchi and Shinohara and destroyed Yokokawa's health. The company paid fines and compensation, but to Ouchi's family, no amount of money could restore what was lost. Japan's nuclear industry faced intense scrutiny. The Tokaimura accident exposed widespread safety violations and corner-cutting across the industry. Regulations were tightened. Safety protocols were strengthened. But for Ouchi, these changes came too late. The medical staff who treated Ouchi struggled with trauma for years afterward. Some left the medical field entirely. They'd been trained to save lives, to fight death with every tool available. But with Ouchi, fighting death meant prolonging torture. They'd kept a man alive long past the point where death would have been mercy. The case raised profound ethical questions that still resonate today. When does medical treatment become torture? Do doctors have the right, or the obligation, to keep someone alive when there's no hope of recovery and the patient is suffering immensely? Should the patient's wishes, "Diao, let me die," override the medical imperative to preserve life? Where is the line between heroic medicine and refusing to accept inevitable death? There are no easy answers. Ouchi's case is taught in medical schools and ethics courses worldwide as an extreme example of these dilemmas. Most ethicists now agree that keeping Ouchi alive for 83 days was wrong, that his suffering outweighed any potential benefit, that his wishes should have been respected, that death would have been the merciful option. But at the time, in the moment, with families hoping for a miracle and medical teams trained to never give up, those decisions were much harder. What happened to Hisashi Ouchi is one of the worst ways a human being can die. Radiation at that level doesn't just kill you, it unmakes you at the cellular level. Your body becomes unable to maintain itself. You literally fall apart while still conscious. And modern medicine, for all its miracles, couldn't save him. It could only prolong his dying. Today, the site of the Tokaimura accident is decommissioned. There's a small memorial to Ouchi and Shinohara. The JCO company no longer exists. It was absorbed and renamed after the scandal. But Ouchi's story lives on as a warning about nuclear safety, about corporate negligence, about medical ethics, about the limits of what medicine should do, even if it can. Hisashi Ouchi didn't want to be a symbol or a cautionary tale. He just wanted to do his job and go home to his family. Instead, he became the man who suffered one of the worst deaths in medical history, kept alive for 83 days while his body rotted away, begging to be allowed to die. The photos of Ouchi's condition, taken for medical documentation, have never been officially released. They're considered too disturbing, too graphic, too traumatizing, but they exist in medical archives as a reminder of what extreme radiation does to the human body. And they're a reminder that sometimes, death is not the worst thing that can happen. Sometimes, being kept alive is worse.